A standards-based approach is starting to define what are the common standards that need to be in place in order for those systems to talk to each other. BC is not fully in a fully integrated system yet, but we're hopefully on a path soon. An open standards-based concept is what the patients have been saying is we really want access to our information. We want access to our full information, not have to go through portal soup trying to find and coordinate all their information together manually. They're saying they want their information to be portable.
Well, if you travel, or if you travel within the province right now, there's no way to access from Northern Health to Interior Health. You can't access that EMR. You can't access that chart. So they are really at a loss when they leave. And with an open standard, hopefully then the consult notes and the information they get from down in Vancouver, if they go for a cardiac consult, will then feed into their PHR so that their doctor, who might get it later, can also see it.
A common thread through all the different projects that we did with quality improvement, panel management, understanding our practice, reflecting on our ability to provide care, was that patient activation was key. Patient understanding of their own health and being able to be participants in it as a team member, being really their own quarterback, as it were, with me just being their coach.
They also want to be able to communicate with their providers and be a partner in their care. So whether they're with their GP or maybe they're skiing in Whistler and they get hurt, they've got their health information at their fingertips for the next person that needs to see it, and have the conversation and understand their health status, their health risks, and their health management plan. And that whole shared care plan is part of everybody involved in this.
We're missing explicitly writing it down and saying, this is our vision. This is how we collectively are going to operate with those standards. We're going to pull this and this and this in as a cohesive unit.
So there's a turf piece to this, which I think is part of the reason why people don't necessarily want to democratize health data, because kind of they may be worried about losing control. So an open standards kind of piece, I think, mitigates some of that, because it's not giving power to another entity. It's not giving power to an EMR or an EHR or a government or whatever. It's giving kind of the ability to communicate and ultimately kind of recognizing the patients do own their own health data.
Patients need to own this. They need to have it in a way that's not held hostage to whichever practice they're in, whichever province they're in, what functionalities are provided. To be an open source, but I say that in quotation marks, an open system that can connect to things everywhere.
I think the open standard approach means a lot of the disconnect that we have right now is that they don't talk to each other. So if from one standard now, if everything has to meet those standards, then anything new you bring on board, if it always has to meet those standards, it talks to each other. You're all talking the same language.
Think of it as Lego blocks. You just need to build the Lego blocks for each of the pieces of data.
It's making sure that all the systems are integrated and using common standards across all of the systems so that we know the information is moving in the right way and safely across systems as well. And that's not in place in a lot of regions. There's still a lot of silos.
Our vendors and innovators have great ideas that they struggle to implement or scale because of fragmentation in the health data ecosystem.
The interoperable approach, where we have an ecosystem that allows things to transport and be used locally, is an efficient model to aspire to, and it's one that I certainly believe is at the present in Canada, and especially in British Columbia at this time, is the best way forward.
One of the ways we want to do that is take a standards-based approach, is starting to define what are the common standards that need to be in place in order for those systems to talk to each other. BC is not fully in a fully integrated system yet, but we're hopefully on a path soon.
We owe it to our patients to design and deliver a system of health information exchange that follows the patient wherever they seek to receive their care. That should be the fundamental driver.